The paper that's being published in Pancreas is a culmination of about 7 years worth of work done by Dr. O in my lab. It basically shows that there is a new gene that we have discovered, which we have called IHOP, which stands for islet homeostasis protein. This protein seems to be a very key figure in type 1 diabetes. If this gene is present under normal conditions, we have patients who produce normal insulin and normal glucose levels. But if the gene is knocked out and the IHOP is lost, we have an incident of what it looks like to be type 1 diabetes. So we're assuming that type 1 diabetes was always a autoimmune disorder, but this data may actually show that it really isn't an autoimmune disorder. It's the lack of a gene, IHOP. We still have a long ways to go in understanding what this gene can and can't do, but we do know if we give part of this protein to this diabetic mouse, they become euglycemic and the pancreas begins to look normal. So it could be that instead of a patient having to test their blood on a daily basis, that they have a patch that they just put on a monthly basis where a time release into their stream with this peptide that will keep this pancreas happy and producing the insulin they need to. Hypothetically speaking, it could be that type 1 diabetes may be a thing of the past.